In today's video, we're going to pull back the curtain and explore 12 of the earliest signs, the initial warning bells, indicating a potential decline in kidney function. This is a condition that can quietly erode your health, often going unnoticed. The unfortunate part is that most of us unknowingly dismiss these signs, assuming they're just fleeting, insignificant symptoms. Little do we realize our kidneys are silently weakening, day by day, hour by hour. Millions of people day in and day out ignore the signals their bodies are sending, the silent pleas for help, the urgent SOS calls, indicating that their kidneys are in distress. It's heartbreaking that in the United States alone, 37 million people, that's a truly staggering number, are battling kidney disease. But tragically, 90% of them are completely unaware that their kidneys are gradually losing their essential functions, slowly dying. This small, unassuming, yet incredibly vital organ tirelessly filters roughly 50 gallons of blood daily, keeping our bodies purified and healthy. When it starts to struggle, it sends out specific warning signs, whispers that we need to listen for. In this video, we'll decipher 12 critical warning signs, signals that most of us tend to overlook, attributing them to simple fatigue, the effects of aging, or just stress in our lives. But in reality, they can be early indicators of kidney disease, desperate cries for help, alarm bells that you should never ignore. So let's dive into the details right now to gain a better understanding, to decode these signs, and equip ourselves with the knowledge to protect our health, to safeguard the incredible blood-filtering machine that is our kidneys. The first sign: fatigue and weakness. Typically, even after a full night's sleep, you still wake up feeling completely exhausted, as if you've just fought a grueling battle, draining all your energy. You find yourself constantly reaching for tea or coffee throughout the day to try and stay awake. And even the simplest, most familiar daily tasks feel incredibly difficult, simply because your body is so tired, worn out, and devoid of energy. This isn't just the normal fatigue you might experience after a long, stressful day at work. It could be a common sign of kidney-related problems, a warning that you should pay close attention to and not dismiss. When your kidneys aren't functioning properly, toxins accumulate in your body, negatively impacting many vital organs. The ability to transport oxygen in the blood also significantly decreases, leaving your body oxygen-starved. This happens because damaged kidneys produce less erythropoietin, a hormone crucial for creating red blood cells, the warriors that carry oxygen throughout the body, nourishing every cell. According to reputable scientific studies, about 60% of people with a chronic kidney disease experience anemia, or a deficiency of red blood cells, a significant number that should give us pause. According to the American Journal of Kidney Disease, when the number of red blood cells decreases, oxygen can't reach the brain and muscles adequately, causing the patient to feel constantly tired and lacking energy, as if their body's energy reserves have been completely depleted, leaving only an empty, lifeless shell. This persistent, ongoing fatigue is often mistaken for work-related stress or the effects of aging, reasons we often use to dismiss and reassure ourselves, soothing our worries. But in reality, it's a common sign of kidney problems, an early warning that you shouldn't ignore. Don't lull yourself into complacency with subjective justifications. Stay alert and recognize the signs. The second sign: swelling in the feet and ankles. Many people notice their shoes feeling tighter than usual or they see deep indentations after taking off their socks, marks imprinted on their skin. They often attribute this to standing for too long during the day and dismiss it, not paying much attention. But in reality, this could be a specific sign of kidney disease, a sign that you should be aware of and not take lightly. Healthy kidneys remove excess salt and water from the body through urine, helping to maintain homeostasis, a stable, harmonious internal environment that keeps everything running smoothly. But when the kidneys are damaged, they can't control this vital balance, leading to a system disruption where everything becomes chaotic. This causes excess fluid to accumulate in the body's tissues, leading to edema, which often concentrates in the lower body, such as the feet and ankles, making you feel heavy, uncomfortable, and very inconvenienced in your daily activities, losing your sense of comfort. This isn't just temporary swelling caused by eating too much salt, a condition that might improve after a few days of dietary adjustments. Instead, it gradually spreads from the feet to the lower legs, hands, and even the face, making your body look different, deformed compared to normal, affecting your appearance. Changes in urination. Abnormal changes in urine are a particularly important sign of kidney-related problems, a sign that you need to pay close attention to and should never disregard. The scariest sign is foamy urine, resembling the foam after beating eggs and not dissolving quickly, forming a strange film on the surface, an unusual, worrisome phenomenon. This is actually protein in the urine, something that should never happen in a healthy person because protein is a precious asset to the body, the foundation of life. Healthy kidneys keep protein in the blood, ensuring that it's not lost, preventing the waste of valuable resources and nutrients. But when the kidneys are damaged, they start to leak protein, causing protein to appear in the urine, a sign exposing the kidney's weakened state, a desperate cry for help. According to the Clinical Journal of the American Society of Nephrology, proteinuria is the earliest sign of kidney damage, an early warning that you need to seize. Don't miss the golden opportunity to treat and save your body's blood-filtering machine. Another sign is nocturia, meaning you have to wake up multiple times at night to urinate, affecting your sleep and overall health, making you feel tired and uncomfortable the next day, losing your alertness. The fourth sign, shortness of breath. Typically, climbing stairs, something you used to do easily, now makes you pant and struggle for breath, as if you've just run a long distance, a worrying sign that you shouldn't take lightly. Most people immediately think of problems with the heart or lungs, the vital organs of the respiratory system, the prime suspects, the usual culprits. But in reality, this shortness of breath can also be caused by kidney-related problems, something that few people expect or consider. A large study of over 4,000 patients, published in the American Journal of Kidney Disease, demonstrated that shortness of breath is one of the most important signs of kidney disease, a sign that you shouldn't dismiss. Be cautious. Don't be complacent. The first reason is anemia. When the number of red blood cells decreases, less oxygen reaches the organs, making the body weak and tired, like a machine running low on fuel, unable to operate smoothly. The second reason is that damaged kidneys can't remove excess water from the body, leading to fluid buildup in the lungs, causing pulmonary edema, a dangerous, life-threatening complication. When the air sacs in the lungs fill with water, oxygen has difficulty reaching the blood, and you'll feel like you're drowning from the inside, a very uncomfortable and terrifying sensation, as if you're imprisoned within your own body, unable to escape. The fifth sign, nausea and vomiting. Persistent nausea for no clear reason, loss of appetite, or a lack of interest in foods you used to love can indicate a buildup of toxins inside your body, a warning of potential health problems. Don't disregard it. When the kidneys don't perform their filtering function properly, waste and toxins accumulate in the blood, causing a condition called uremia, a dangerous condition that can damage many organs in the body, affecting overall health and threatening life. According to a scientific study, these toxins not only cause irritation and ulcers in the stomach, but also disrupt the appetite control center in the brain, making you feel disinterested in food and lose your sense of taste, no longer enjoying the flavors, the feeling of excitement associated with food. This leads to persistent nausea, vomiting, and a complete lack of interest in food, causing you to not want to eat anything, leading to malnutrition and a weakened body. As the kidneys weaken, this problem becomes more serious, significantly affecting your quality of life, making you feel frustrated and hopeless, losing your joy in life. The sixth sign, persistent itching. The itching comes from within, as if thousands of ants are crawling under your skin, and the more you scratch, the more it spreads, making it uncontrollable, an extremely uncomfortable sensation, unbearable. This isn't just normal dry skin or itching due to allergies, conditions that you can easily resolve with moisturizer or antihistamines, familiar remedies that are readily available. This is a burning and itchy sensation all over the body, causing extreme discomfort and restlessness, affecting your sleep and mental state, like a persistent torture without end. Research from clinical nephrology shows that up to 90% of people with end-stage kidney disease suffer from this persistent itching, an alarming number that indicates the severity of the problem and needs attention. When the kidneys can't filter toxins like phosphorus and urea, they accumulate in the blood, causing skin itching, making you feel extremely uncomfortable, restless, and wanting to tear your skin, unable to control yourself. The seventh sign, metallic taste in the mouth. When the taste of food suddenly becomes strange, as if you're holding a piece of metal in your mouth, it's not just an unpleasant experience, but also a sign that toxins are accumulating in the blood. A warning about potential health problems. You need to be cautious and shouldn't take it lightly. According to a study, uremic toxins directly affect our taste buds and olfactory system, altering our perception of the taste of food, making everything taste terrible and harder to swallow. This is why you always have a metallic or ammonia-like taste in your mouth. A very uncomfortable and strange sensation, making you feel disgusted, losing your appetite. This makes you no longer enjoy food, not even wanting to eat anything, leading to a weak body, malnutrition, and weight loss, significantly affecting overall health, making you feel worried and anxious, losing the joy of eating. This taste problem is often accompanied by bad breath, smelling like ammonia, because the toxins in the body are also released through the breath, making you feel self-conscious and hesitant to communicate, affecting social relationships, losing confidence. The eighth sign, muscle cramps. The muscles become stiff and sore, especially in the legs, making you feel extremely uncomfortable, as if being tortured, unbearable. These aren't just normal cramps after exercise, but more intense cramps that occur more often and usually happen even when you're resting, making you feel helpless and worried, not knowing what to do, losing control. Continuous cramps, especially in the legs, can indicate that the kidneys can't maintain the balance of minerals in the blood, an important function of the kidneys, signaling a weakened state that needs attention. Healthy kidneys play a role in maintaining normal levels of important minerals like sodium, potassium, calcium, and magnesium, ensuring the smooth functioning of muscles and nerves, helping the body move flexibly without obstacles. But when the kidneys are damaged, this balance is disrupted, leading to pain and severe muscle tension, affecting your ability to move and your quality of life, making you feel tired and frustrated, losing flexibility. The 9th sign, poor concentration or brain fog. You often walk into a room and forget why you came there, as if your memory is playing tricks on you, making you annoyed and uncomfortable. You read a passage over and over, but still can't understand the content, as if a layer of fog is covering your mind, hindering your ability to absorb information, unable to concentrate. This isn't just due to work-related stress or the effects of aging, reasons we often use to explain forgetfulness, not being able to concentrate. But it could be due to kidney-related problems, a warning about potential health problems. Don't ignore it, pay attention. According to scientific research, when the kidneys can't filter waste products, these toxins circulate throughout the body and go straight to the brain, affecting brain function, a direct attack causing damage. These toxins cross the blood-brain barrier and weaken the normal functions of the brain, causing brain fog, making you feel confused and disoriented, unable to think clearly. Doctors call this uremic encephalopathy, a serious condition that impairs memory, concentration, and thinking skills, affecting your ability to work and study, making you feel helpless and insecure, unable to reach your full potential. The 10th sign, eye bags. According to research, the skin around the eyes is the most sensitive to water retention, because the skin in this area is the thinnest compared to other areas of the body, acting as a mirror, reflecting your health, showing what's happening inside. When the kidneys don't filter protein properly, albumin and other essential proteins leak into the urine. Instead of being retained in the blood, an unfortunate loss, wasting resources. This protein leakage disrupts the fluid balance in the body, leading to fluid from the blood vessels spilling out and accumulating in the tissues, causing edema, making your face look heavy, losing its clear features. And eye bags are the first sign to appear, the most noticeable sign, especially in the morning after waking up. When you look in the mirror, you'll see it clearly. The 11th sign, high blood pressure. If your blood pressure is rising abnormally and can't be controlled even with medication, then understand that it could be a kidney problem, a warning about potential health problems. Don't be complacent. Take it lightly. According to scientific research, the kidneys play a crucial role in regulating blood pressure, helping to maintain blood pressure at a stable level, acting as a conductor, controlling the system, keeping everything balanced. The kidneys control the volume of fluid in the blood, helping to regulate the amount of blood circulating in the body, not allowing too much or too little. They produce hormones that control the function of blood vessels, helping to regulate the constriction and dilation of blood vessels, not allowing blood vessels to be too narrow or too wide. And they maintain the balance of sodium and potassium, two important minerals that affect blood pressure, helping the system run smoothly without problems. Damaged kidneys can't remove sodium and excess fluid from the body, which increases blood volume and raises blood pressure, causing high blood pressure, like a ticking time bomb that can explode at any time. At the same time, damaged kidneys produce more renin, an enzyme that causes blood vessels to constrict and raise blood pressure, making high blood pressure more difficult to control, like a dangerous spiral, difficult to escape. The 12th sign: dry and flaky skin. If your skin becomes dry, flaky, or intensely itchy in an unusual way, and there's no improvement even after you've applied moisturizer regularly and drunk plenty of water, then don't ignore it just because you think it's a cosmetic problem. An unimportant problem. Be cautious. This could be a sign of a serious imbalance happening inside the kidneys. A warning about potential health problems. Don't neglect it. Take it lightly. Our skin is truly a mirror, reflecting our internal health, showing what's happening inside the body, acting as a diary, recording changes, showing abnormalities. According to scientific research, healthy kidneys play a role in maintaining the perfect balance between minerals, vitamins, and nutrients. Important factors that help keep the skin healthy and youthful, acting as a silent guardian, keeping the skin radiant. When kidney function declines, this balance is disrupted, affecting the health of the skin, making it ugly, losing its natural beauty. Damaged kidneys can't regulate phosphorus, leading to an imbalance of calcium and phosphorus and impairing the function of skin cells, causing the skin to become dry and easily flaky, losing its smoothness and softness. At the same time, a deficiency of essential nutrients such as vitamin D and vitamin B, which are very important for skin health, also contributes to making the skin dull and lifeless, looking tired and lifeless. Chronic inflammation also damages collagen and elasticity. Your skin may start to feel dry and less supple, losing its youthful glow and elasticity. Really take a close look at yourself for these telltale signs, and don't hesitate to consult with a doctor the moment you notice anything out of the ordinary. Early diagnosis and treatment are key, so don't delay, or things could get much worse. Fatigue steals your energy, making it hard to fully enjoy life. You lose your sense of joy and enthusiasm. Brain fog clouds your thinking and understanding, impacting your work and studies, hindering your progress and preventing you from moving forward. Swelling distorts your body shape, making you feel self-conscious and insecure. You might feel ashamed and want to hide from the world. Changes in your skin can mar your appearance, affecting your mood and confidence. You might feel down and disappointed. All of these signs are sending you a clear message. You absolutely can protect your kidneys by taking prompt action. Don't let things go too far. Be proactive about your health, and don't be indifferent. To get started, your doctor might suggest 2 simple tests: a blood test to check your creatinine and GFR, glomerular filtration rate, and a urine test to check for protein in your urine. These are powerful weapons for detecting kidney disease early. Both tests can detect kidney problems in their initial stages, which makes treatment much easier and more effective. This increases your chances of recovery and minimizes the risk of complications. Thank you so much for visiting our channel and watching this video all the way through. We really appreciate it and are grateful for your attention. If you found this video helpful, please don't hesitate to hit the like button and share it with your loved ones. Spread this helpful information to help others. And if this is your first time visiting our channel, please subscribe so you don't miss other helpful videos. We'll always do our best to bring you valuable information. We would like to invite you to subscribe to our channel right now so you never miss another fascinating and helpful video in the future. Join us as we take steps to cultivate and protect your overall health. We're really looking forward to seeing you again in our next videos. We sincerely wish you all the best, filled with energy and with the ability to love and care for yourselves in a really thoughtful manner. That's a wish that comes straight from the bottom of our hearts from the entire team here.